How are you all? This lesson is about the signs and symptoms of kidney disease, also called renal disease. We'll talk about a wide range of signs in this video. Signs that can be seen from the beginning of an illness, like early kidney disease, all the way up to kidney failure. So, the first one I want to talk about is changes in urination. It makes sense that if there is a problem with the kidneys, urination can change. And sometimes the amount of pee can go up or down. So, in some kidney conditions, we see more urination or more urine volume. So patients may have to go to the bathroom more often to urinate. In more advanced stages of kidney disease, we often see less urination or less urine volume. Some other kidney diseases can cause bubbly urine, which means you may have protein in your urine. And in some cases, blood in your urine, which is called hematuria. The next sign we'll talk about is swelling around the edges of the body. So peripheral edema looks like this. If you look at a person's legs here, you can see that there is a lot of interstitial fluid in the tissues where it shouldn't be. And if you press your finger on that area and let go, you can see this pitting. This is what we call pitting edema. Therefore, advanced kidney disease can contribute to this by causing too much fluid or volume. If a person isn't urinating enough, or losing enough volume through their kidneys, they can have volume overload. This can lead to more volume or fluid in their interstitial areas. And we often see this in their lower limbs. This is also true of nephrotic syndrome, a type of kidney disease in which a lot of protein is lost, especially albumin. Albumin is the most common protein in your blood, and it helps reabsorb fluid from your tissues back into your blood. But if albumin is lost, which can happen in nephrotic syndrome, there won't be enough albumin in the blood to help reabsorb some of the fluid we see in some of these cases. The next sign of kidney disease is high blood pressure or hypertension. So, again, this is because of increased intravascular volume. If a person doesn't pee enough, they can have increased intravascular volume, which means they have more fluid in their circulatory system. This can cause hypertension or high blood pressure. And dyspnea, or shortness of breath, is another sign of kidney disease. The same things that cause dyspnea frequently also cause this. So, again, if there is a volume overload, we can see peripheral edema and high blood pressure. And this can even lead to more fluid or volume in the chest cavity, the thorax. The extra fluid around the lungs can make it hard to breathe. And these people may also have chest pain. Other signs and symptoms of kidney disease include trouble sleeping. This is because there are more toxins in the body. So people may say they can't fall asleep, have trouble sleeping, or are very tired during the day. This leads to the next sign and symptom that people with kidney disease often have, which is fatigue. So, they are often very tired during the day. And there is a lot of daytime sleepiness. Again, this is because there are more toxins in their bodies. And the kidneys clear them out and get rid of a lot of them. If the kidneys aren't working right, toxins can build up and make people tired. Anemia is another condition that can make people tired. We'll talk about anemia caused by kidney disease in a moment. The fatigue may be linked to the trouble sleeping we just talked about. Sleeping problems, increased toxins, and anemia can all cause fatigue. The next things a person might notice are jerking and spasming muscles. This is often caused by electrolyte imbalances. The kidney is very important for keeping a lot of chemicals in the body in balance. And if there are electrolyte imbalances, it can cause problems with muscle contractions and spasms. When a person has kidney disease, they often have low calcium and high phosphate, which can cause their muscles to cramp and twitch. We've talked about this before, but people with kidney disease can also have anemia, which means they have too few red blood cells or not enough hemoglobin. This is a sign of chronic kidney disease or anemia. So again, this usually happens later in the course of chronic kidney disease. This is because the kidney makes erythropoietin, or EPO, which stimulates the bone marrow to make red blood cells, erythrocytes. As the kidney gets worse, it has less and less ability to make erythropoietin, which leads to fewer and fewer red blood cells. Now that we've talked about how important the kidneys are for getting rid of toxins and keeping electrolytes in balance. Urea is a toxin, so the kidneys usually filter it out and get rid of it. So, urea is a waste product of how proteins are broken down. And when the kidneys fail, there is more urea in the blood. This is called uremia. So, too much urea in the blood, or uremia, can cause a number of important signs and symptoms that we need to look out for. One of them is uremic pericarditis, which means that uremia can cause inflammation of the pericardium. Uremia and other metabolic toxins can also cause inflammation of the layers of the pericardium. So we can see people with chest pain that is often caused by the way they are sitting or standing and may also be pleuritic. And uremia can cause uremic encephalopathy, which is often seen in people with more advanced kidney disease. This kind of encephalopathy can cause a change in mental state, like dizziness or confusion, in these patients. Asterixis is a sign of uremic encephalopathy. So, if someone has uremic encephalopathy, they may have this sign, which is called asterixis. But what is asterixis? It's actually a tremor flap at the wrist. A doctor will have a patient put their arms straight out in front of them, lift their wrists like this, and close their eyes. If the patient lets go of their hand or loses control and it falls here, the doctor will quickly bring it back up into the original position. This looks like a tremor flap. Again, this is because of uremia. Uremia can make a person feel very itchy on most of their body, which can lead to excoriations or scratch marks on many parts of their body. This is another sign of kidney disease. This is also sometimes called uremic pruritus. So, a feeling of itching is caused by too much urea in the blood. Uremia can also cause sickness and vomiting. So people with advanced kidney disease often feel very sick and don't feel well. Once more, uremia is the cause of this. And it can cause anorexia or weight loss, which can cause patients to become very thin. They don't have much an appetite because the uremia. And it also causes nausea and vomiting. Another important thing to remember is that platelets don't work right. This is again because of uremia. So, uremia can cause platelet dysfunction, which means that even though platelets may look like they are at a normal level or in a normal range, they may be dysfunctional, which can look like thrombocytopenia or a low platelet count. Patients with platelet dysfunction caused by uremia can have more bleeding from their gums and skin, like if they cut themselves on their hands. So, all of these are signs that platelets aren't working right. So again, platelet dysfunction caused by uremia leads to gingival bleeding, bleeding from the skin, epistaxis, petechia, purpura, and easy bruising. There is also a higher risk of excessive bleeding during menstruation, surgery, childbirth, and the time afterward. So, I hope you learned something from this video. If you liked it, please give it a thumbs up and subscribe. Thanks so much for watching. And I hope to see you again soon.